the Rogel Cancer Center has the privilege of being one of 71 cancer centers in the US that are designated by the National Cancer Institute. And we're one of 51 centers designated as a comprehensive cancer center, which we've been designated as that since 1991. And that reflects the range and breadth of our activities across the full cancer field, as well as our activities in training the next generation of cancer providers and cancer research pioneers and service to communities around the state and around the country and around the globe. The mission of the Rogel Cancer Center is to reduce the burden of cancer and advance health equity through transdisciplinary collaboration and research, education, patient care, as well as community outreach. And our vision is to be a leader in prevention, early diagnosis, optimal treatment, and care for all of those at risk of or affected by cancer. Our members at the University of Michigan come from 9 schools and 44 primary departments, and they collectively hold appointments in nearly 55 departments, counting their secondary appointments. So very robust and deep engagement of the broad collection of schools at the University of Michigan. The schools and colleges that we engage are in the center panel, and they range from dentistry to social work. And you'll hear today from 2 colleagues of mine in the College of Pharmacy as their primary appointments. We also engage a number of institutes and centers that cut across the fabric of the institution, multidisciplinary and transdisciplinary in nature. And I won't review all of these, but they're powerful engines of discovery, each in their own way. The Cancer Center members, 83% of them have active grants. The members who don't have active grants tend to be very new faculty or faculty who are deeply engaged in clinical research. And our annual cancer funding in terms of annual direct cost expenditures is nearly $120 million. The lion's share of that is from the National Cancer Institute. And then we have a significant funding from the NIH as well as other peer-reviewed organizations. And our Cancer Center funding from the NCI has grown about 40% over the past 4 to 5 years. Among the many metrics that we keep track of are the number of papers that we publish annually, the collaborations of those between programs and within research programs, as well as the impact factor. But we keep track of many other metrics, including patents and technologies that are licensed. We're very active in clinical research, and this just highlights some of the metrics around how long it takes to activate trials, which we're working very hard to get well under 100 days and making strong progress in the recent quarters in that area. We're deeply engaged in treatment research as well as interventional trials that focus on cancer symptom management or improving outcomes for cancer patients and survivors. And at any one point now, we have a little in excess of 200 open clinical trials that are accruing. We have a very distinguished collection of members, and some of the many highlights of the members are highlighted here. They include election to the National Academy of Medicine, the National Academy of Sciences, and some major prizes that are highlighted in the center. And I'd call attention to Dr. Rogel Cancer, who's an extremely eminent cancer geneticist who just received the Schoberg Prize, just announced, and will be going to Stockholm to receive that prize later this month. Our Senior Leadership Council is really critical to our activities, and that group of colleagues is highlighted here. Deputy Director Dr. Pavan Reddy and the various associate directors, each working in particular areas, including research across the continuum, career development and training, community outreach and engagement, a broad collection of efforts in diversity, equity, inclusion, and justice, as well as Julie Brabs, who's vital to essentially coordinating all of our activities as in her role of AD for administration. I have 6 research programs cutting across the landscape of cancer, from very basic work on the origins of cancer and behaviors of cancer, all the way to health policy and implementation over on the far right of the slide. And each of the programs has very robust funding and very robust publication and collaboration metrics and the impact of their work. And so it's an extremely talented team of scientists. Our strategic research priorities for the next 5-year period are highlighted here: cancer initiation, progression, and resistance, cancer treatment and care delivery paradigms, and cancer risk reduction. And in line with all of these priorities, we're always considering how do we impact on citizens in the state of Michigan and beyond. So studying cancers that are particularly high incidence associated with poor outcomes and disparities, and advancing cancer health equity is one of our top priorities. The research themes that really unite members, the 300 plus members in our cancer center, are highlighted in the lower portion of this slide. And you can see they go from the northwest quadrant of the panel, from tumor metabolism and microenvironment work, quite basic work in laboratory-based studies for the most part, all the way to issues in health policy, healthcare implementation, and defining what's high-value care and most cost-effective care treatments. Just want to highlight some papers from just the past year that we're extremely proud of. One of the areas that were particularly noteworthy, and you'll hear some of our efforts today from Drs. Moon and Niamati, is really in cancer targets and treatment research. And these are just some papers from the past year that highlight some of that really exciting work. Cancer metabolism and tumor microenvironments, another extremely busy area in our cancer center. And I think we're leaders nationally in that area and internationally in a number of cancer types and a number of cancer TME factors. Cancer immunity and immunotherapy, also some terrific papers from Weiping Zhu and James Moon and others here highlighted on this slide. And pediatric brain tumor research, again, a relatively uncommon but extremely unfortunate cancer for families and children affected by this. And we're making some significant strides in this space. Also work moving to the clinic from discovery work in our own laboratories. Bone marrow transplantation, similarly, all the way from the laboratory to the clinic, and national studies arising from the work that we're doing here at the University of Michigan and understanding how to manage acute graft versus host disease in much more robust